which is gonna allow for still allow for full knee flexion. You can also go this direction, but that's gonna limit knee flexion and extension a little bit, which you might want for your patient. So just keep that in mind. So you can try either way. You can try it one way on one of you, one way on the other, see what you think. So, but I'm gonna kind of pre-measure. We don't need to go behind the knee joint because ow. Also, think about tape allergies. If anybody knows that they are sensitive to tape or adhesive, ooh, I need a little bit more from the, over there, the white boxes. I thought I had enough for one. You're not gonna want to use tape, or you could, yeah, that's it. Or you could use milk of magnesia to kind of spread on the skin ahead of time, and that kind of helps. Milk of magnesia, what they use for indigestion. So that white stuff.
Find the magnesia in the...
Yeah, milk of magnesia. So it actually does really well to protect the skin for people that might be sensitive to tape and adhesives. So this has got a little bit of a trying to help you on the back, I know, which sometimes doesn't work. I think our tape is getting old. So if that happens, go at it again. So, and this is just to protect the skin. So this is McConnell-based taping. These are pretty, oh, and I hate it when that happens.
That's to protect the skin.
If that happens, you throw it at Aaliyah, sorry.
I'm good.
You got that on video, didn't you?
Yes, I did.
Is this not supposed to stick to the skin as much?
This sticks to the skin just fine. It's just very hypoallergenic. It's kind of like a paper tape. It is.
Oh, so when you say protect the skin, it's
So
not
this is
when they peel
because
it
this
off.
will rip your skin off.
Oh. And what? That's what I'm asking. So that won't rip your skin off.
This will not rip your skin off.
Oh,
This is the non-rip the skin off tape. Okay.
okay, so that's kind of like...
So this is just to protect the skin. And I'll find her patella, okay? And I kind of want to cover that patella and just protect the skin for the taping that I'm going to do. Okay. So with McConnell taping, and I do believe it was Michelle or Jenny McConnell, can't remember exactly, threw some tape on a patient one time and said, wow, this really helps for patellofemoral pain. And so kind of came up with the technique of McConnell taping. But it is more of a strapping tape. I'm having trouble. I know, Doc. I'm having trouble with my cover roll. Yeah, Doc, everybody. As I'm trying to demonstrate this on video. Thank you, Carl.
Mm-hmm.
Thank you. Oh my goodness, thank you, Maka, for being assisting. So, okay.
This is just the watch.
Now, that happened, that was really easy. No issues at all. Okay. So you're just gonna lay that down over the patella. Again, you can go this way too if you want vertically with them. Either way is appropriate. So this is your Luca tape. And it is pretty sticky and it will rip their skin off. So, but this is a strapping tape. It does not have any stretch to it either direction. So it's really a strapping type of tape. So what we're trying to do is affect the patellar mobility and the motion of the patella, because we're going to do this typically because we believe that the patella is not tracking appropriately in the patellofemoral groove. And that's one reason that we theorize that somebody's having patellofemoral pain. So the idea is that we're going to take that patella and kind of shift it over the femur. Now we talked in lecture and I said, you know, are we really going to be able to move the patella once a quadriceps is contracting? Probably not so much, but we're also going to work on hip strengthening to kind of move the femur underneath the patella. So this is going to give more of that proprioceptive input and help with the neuromuscular control of how the quadricep is firing, not necessarily really moving the patella. But that's kind of the theory. So most patients with tracking problems, their patella tend to track laterally as they're contracting the quadriceps, and that's causing the back of the patella to kind of ride over that groove, not as smoothly as it should, because it could be causing pain on the back of that patella. So if we want to help it track more medially, you can take your tape, doesn't need to be a long piece, find their patella, okay, and there it is. You got tiny patellas. Oh, thank you. I know. Nice and petite. Okay, so, and you can do this a number of ways, but the way that Johnny showed is kind of grabbing that whole patella and doing about 3 pieces of tape. So grabbing that lateral border of the patella and sticking your tape down. And then what you're going to do is you're going to pull, and you want to see little wrinkles as you lay down that tape, because I'm really trying to pull that patella over. Okay. and about 3 pieces of tape usually do a good job. So I'm gonna take one and I kind of made a little bit of a curve to it to grab that top base. Remember, the base is the top part of the patella, because that makes sense, right? Okay, and then the same thing, I'm gonna pull and come back over, so I've kind of done almost like a little eyeball, and then I can take one more piece straight over the top to do the same thing. It stuck to itself again. Okay. And I'm gonna, not do that. Pull that over. Okay. So it's okay to get little wrinkles. You kind of want to see those little wrinkles. That means you're moving the skin. This is one-time wrinkles are okay. Okay. But it shouldn't be like big fat wrinkles. So kind of lay that tape down as you're going. Don't, and then makes sense, or else you're gonna get big wrinkles. And that can be very uncomfortable to the patient. So then we can have her, with all my messy tape mess, go ahead and sit on up, Miss Wendy. Thank you. And when they start to bend their knees, sometimes it's normal for that to come up a little bit. Just lay it back down. And then we are ready to go do our exercises. So when somebody asked in the previous lab about billing with this, because there's no billing code